Hi, I'm Dr. David Graber. We're here in New Brunswick at the 2015 Association of New Jersey Chiropractor Summit, and I have with me Dr. Armand Rossi, internationally known as a pediatric chiropractic expert, talk about chiropractic care for children and newborns. A lot of the public, the question they have is, why should my child be checked by a chiropractor?
Well, I guess the number one reason is they were born. Okay, because birth is a trauma. Even under the best circumstances, birth is traumatic. And you can cause many injuries at birth. And of course, the child cries, the mom burps it or feeds it and changes the diaper. And as long as it's not bleeding out its eyeball, they think the child's fine. But I believe that every child born should be chiropractically checked to make sure there's no nerve interference or subluxation in the child's spine, because that's a detriment to health and growth.
You mentioned subluxation. Can you just explain that?
Sure. Subluxation is when you have misalignment of either the vertebra or the spinal structures itself that causes nerve interference to the nerve root or the spinal, the central nervous system.
Okay. And what might be some common signs that parents could look for if that happens?
Well, sometimes it's something very simple. Okay, example, baby will only breastfeed from one breast versus the other. Okay, that means they prefer to turn their head one way instead of the other. Okay. That's a sign of a cervical or neck problem in there. Of course, the colicky type of crying, the baby pawing up at its face, like maybe for ear infection, maybe some injury. Sometimes it's cranial pressure involved. It just usually, I tell people it's best to get the child checked. You go to the dentist to get checked.
Right.
Why not go to the chiropractor to get the child's spine checked?
Exactly. Exactly. Well, I know being in practice myself for years, taking care of children and parents, and bring the issue up. Mm-hmm. Some parents are concerned about how safe is it for my child. They get adjusted. They're wondering if it's adjusted the same way.
Okay. Well, first let me take the safety issue out of it. Okay. I've adjusted many kids, including my own. Both my son and daughter were adjusted for the first time with the umbilical cord still attached.
Wow. That's
how soon they were adjusted and checked. I would not do anything that's unsafe to my own children. Okay, I would not do that. You know, Jonas Salk, the inventor of the polio vaccine, wouldn't give his kids his own vaccine in the beginning. Yeah, but I would adjust my kids. Okay, right. And so if anybody has any doubts about safety, think about that. Also, look at the malpractice insurance rates. Okay, malpractice insurance rates for chiropractors, mine is like $1,600 for the year, compared to over $20,000 for medical malpractice insurance rates. And insurance companies don't care; they're going by the bottom dollar. So, what do you think is safer with that? So that's no problem. Now,
I'm sorry. Techniques that you use with children, is it the same as adults?
No, it's not. It's not. You don't treat a child like a little adult. You work with them. There's different bone growth in different times, structure changes, and there's ways of adjusting the child. In fact, when I adjust a newborn baby, if they're asleep, half the time they don't even wake up, because it's a gentle adjustment. Okay. I like to use this demonstration. Take my finger with a little bit like that. That's about as hard as it gets. Okay. To adjust a newborn.
So you have to know specifically what to correct.
What to correct, how to do it, when to do it, techniques on how the child can be set up for that, how the parents can help, the whole thing.
Okay. Now this weekend you're going to be teaching doctors, field doctors, these techniques.
Yes.
They can bring back to their offices as
We're going to talk about a group of techniques. I'm going to kind of demonstrate on a doll some of the techniques on how to work with the child, and I'm also going to take questions from the doctors if they have any specific things they want to talk about. We'll work with that too.
Okay, terrific. Anything else you want to add?
No, I just after being in practice so long and seeing thousands and thousands of children, The nice thing to understand about chiropractic with kids is that the kids respond so much faster than adults. They enjoy getting chiropractic care. I can't tell you how many families where the kids come in and they fight over who's going to be first, okay? Because they know they're not getting any medicine, they know they're not getting any shots, they're getting chiropractic, and it turns on the power within them, and they love it.
Right. That's great. No, I notice that in my practice too. Kids are always like, "Who's first on the table?"
Right, exactly.
Great, terrific. Thank you, Dr. Rossi.
Thank you.
I look forward to your seminar today.
Thank you.
Great.